So we're going to segue to a different topic, looking at currently available treatment. So sickle cell disease has been around for a long time. There initially had been only one FDA-approved drug, and that's hydroxyurea. And over the past, 5 years, we've had several other drugs come to market. So I'm going to talk to Dr. Cantor. Julie, what are the goals of treatment for sickle cell disease? And so how do you determine what the treatment plan should be for your patient when they show up in your clinic?
So I always tell my residents and students, you have to always meet the patient where they are. So I always start with trying to get to know my patients a little bit. What are you interested in? What are your goals? If they're 18, 19, maybe they finished high school, do you want to go to college? So it's really important to understand what their personal goals are as well as their specific goals related to their sickle cell disease. Because sickle cells involve so much in their lives that it's important to know both sides. And then from there, we can talk about how do we best prevent some of the complications. I always try to remind patients that pain is the hardest thing to deal with, and that we know that that's a big problem. But there are other things too. So we have to make sure they're getting their eyes checked regularly, because blindness is a terrible complication. Also getting hearts, lungs, and kidneys checked. So we really talk about the goals of preventing organ dysfunction, making sure that we do appropriate screening and using therapies that can help reduce damage, and then also making sure that we reduce things that cause pain. So while some crises are completely unpredictable, we also know that people can induce a crisis by perhaps stressing themselves out so much that they forget to drink water and they forget to eat. And it would never, ever be intentional. But if we help them learn how to do better stress relieving activities, stay really well hydrated, and avoid things like alcohol that can also dehydrate them.
And so the goal is to have a treatment plan for each patient that is individualized and
Very
specific to
yes.
their needs, their goals, and what their clinical situation is.